Welcome to Ellen in Spotlight, a podcast by the Latino News Network, dedicated to best serving Hispanic Latinos with local multimedia news and information websites across the U.S. I'm reporter and editor Belen Dumont for the Latino News Network and your host. In the 2020 presidential election, about 50% of Hartford eligible voters casted their ballot compared to the state average of 80%. During the 2022 state election, around 26% Hartford voters voted, with the state average being 58%. As Election Day quickly approaches, our conversation today will discuss efforts to civically engage Hispanic Latino residents across Hartford. So joining us is the Hispanic Health Council's Policy Advocacy Manager, Megan Scharrer. Megan, welcome to the program.
Hi, thank you so much for having me today.
Thank you for joining us. I'm excited for our conversation. So to start off, I was wondering if you could tell us a bit about the Hispanic Health Council's campaign this year to inform and motivate potential voters this November.
Yeah, so since the inception of the Hispanic Health Council, our mission has been to empower the Latino community using research and advocacy for social justice reform. And one of those efforts has included getting out the vote. Research has shown that Latinos who are eligible to vote are not voting because of lack of civic engagement, or civic education and understanding how to vote, and barriers to go out and vote, such as transportation, language, and work. And so our goal with this campaign is to engage, educate, and mobilize eligible Latino voters to go out and vote in the election. Our efforts for outreach have included voter education to community members and staff, social media campaign, door-to-door canvassing, and sharing voter registration material. We have also trained all staff at the council on how to register eligible voters and engage in conversations with their clients about voting. All staff as well, they have voter cards from Vote ER, which has a QR code that shares materials with anyone who scans it.
I was wondering if you can also tell us about the collaborative side of this effort and what might have inspired this work. So what specific kind of outreach efforts does it include? And then what's the ultimate goal of the campaign?
Yeah, so since the inception of the council, we've been informed of best practices with working with the Latino community. We have continuously emphasized the Latino culture to connect with the community, and we've stressed the importance of dual voter education and relationship building with this campaign. So it's really important to really talk one-on-one with the community. They want to connect. They want to talk to someone. They don't want to just receive a link on their phone or view it through social media. They really want to chat with people, hear it, and that's very important in the culture. So that's how we've utilized our strategies in this campaign. And we've done that through a lot of collaboration. As the largest Latino serving nonprofit in the state of Connecticut, the Hispanic Health Council, we've taken the lead on bringing organizations together to increase the Latino vote in Hartford. We have a coalition called Get Out the Latino Vote, which includes the City of Hartford, the Secretary of State, Trinity College, and the San Juan Center. We also have around 20 volunteers who have helped us with our canvassing and outreach efforts. And this goes back to really connecting with the community. So when we have people that look like the community and can speak the language, they're going to want to engage more. And so we've really utilized that with the who we're bringing into this coalition, as well as who is helping us in volunteering with us.
Thank you for that. And I was hoping if you could elaborate a little bit in terms of, because we were talking another time about community listening sessions and as well as the door-to-door canvassing. I was wondering if you could tell us about those efforts.
Yeah, so we had a listening session back in August, I believe. And as I stated, the community really shared that they want to have conversations with people. They want to be talking to their neighbors about these issues and be educated on how to talk about or be informed on how to talk about these issues. So that's really our strategies of providing materials like with Vote ER, they provide why you should vote, as well as finding your polling location, am I eligible to vote, and really sharing that with community and making sure our staff knows about how to have these conversations too, because our staff is working with many different clients throughout Hartford. And so by having this knowledge, they can have these conversations with the community. So through the listening sessions, we were really able to understand that. And so then we have been able to take this with our door-to-door canvassing. This 2 weekends ago, we were in the Frog Hollow neighborhood. We door knocked on over 200 doors, and the conversations were really positive. We had a few people that didn't want to vote, and that's typical. You're going to hear those conversations of not my vote doesn't matter. But that was only really a few. And everyone we chatted was like, yeah, I'm voting. I plan to vote early. I vote by mail. And so it was really powerful to see that the community does plan on voting in this election. And so I really think having those conversations, and then also for people that don't answer, leaving leave behinds with important dates where they can find more information is very important, because obviously we're not going to talk to everyone we door knock, but if you have those leave behinds about early voting, about where their polling location is, dates, that is really helpful. We will also be door knocking this weekend around the Frog Hollow neighborhood to remind people to go out and vote.
I'm curious, so you said that there weren't really many there were a few though that did talk about how they didn't think their vote really matters and kind of bringing in that historical distrust that has been, affecting us for several election cycles now. I'm wondering, how your volunteers and you kind of deal with that, what your kind of responses. I know it's a balance, I bet, of respecting their decision, but also hoping to motivate them.
Yeah, so I think there is a balance when it comes to that, because you kind of look at it as a scale of people that might be more open to having conversations, and people are set on my vote doesn't matter. You're door knocking at my house. I don't really want to have this conversation. So we really just chat with people, asking them like why they think that, and then inform them that, your vote is just one step. You have the power to make change in your community. Your elected official's job is to represent what the community wants. So after you vote, you're holding your elected official accountable. So you can do this through policy change, you can do this through campaigns, you can do this through really trying to create social change by holding your elected officials accountable. So we really encourage during those conversations for the community to get involved in community groups, like the council, that the community group we have that I'll talk about later, as well as looking around what other organizations are doing and what campaigns they're doing, whether it is a campaign to make Hartford more beautiful or for healthcare for all, or different things that are really important for the community. We encourage them to get involved, so after they vote, they can do something with their vote.
You are listening to Ellen in Spotlight with Hispanic Health Council Policy Advocacy Manager Megan Scharrer. How does the council look to civically engage residents year round, and why is this important?
Yeah, so a pillar of the Hispanic Health Counselor is advocacy and research. In the research department and myself, the policy advocacy manager, we work closely together to create policy change at a local, state, and federal level. I run a grassroots committee called Community Voices, or Las Voces de la Comunidad, that is made up of Connecticut residents. The member of the Community Voices decide the issues we focus on, and I provide training and support on how to make changes. Our focus areas are housing, healthcare, and immigration. Together, we make change by working with our legislators, advocating at the Capitol, continuous education, and creating different strategies for change. So staying civically engaged year-round is important, because voting is only one part of the equation to make change. After you vote, it's important that you hold those who are in office accountable. Our advocacy work at the Hispanic Health Council is community-led, because the community knows best at what social changes are needed to live in a healthier Hartford, Connecticut, and United States.
I've really enjoyed our conversation. I feel like I've learned a lot, and I really appreciate you coming out with us. I was just wondering, Megan, if you have any other reminders or comments or resources you'd like to share with our audience before we go.
Yeah, of course. So most importantly, make sure you go vote on November 5th, or vote early between October 21st and November 3rd. You can go vote at your registrar of office, our registrar of voters office in Sierra City Hall. If you or anyone you know has barriers to go vote, please contact the Hispanic Health Council at info@hispanichealthcouncil.org, so that we can connect you with the proper resources to make sure you go out and use your voice and vote. And finally, join the Hispanic Health Council efforts of reducing health disparities for Latinos and other vulnerable communities. I'm happy to have any conversations with anyone that would like to get involved. My information will be provided. And yeah, thank you so much for this opportunity to talk about voting. It's a very important thing that people can do to create change in their community.
Just to clarify, if anyone wants to get involved with the council's efforts, I'm assuming they can go in person to the center, they can call.
Yep, exactly. They can come to our office, they can call me, they can email me, whatever's best fit for them.
Thank you so much, Megan. We appreciate your time, and it's been a pleasure speaking to you.
Thank you so much.
You've been listening to Ellen in Spotlight with the Hispanic Health Council Policy Advocacy Manager, Megan Scharrer. Ellen in Spotlight is produced by the Latino News Network. I'm reporter-editor Belen Dumont. Thank you all for listening.
This podcast is sponsored by AARP. AARP Connecticut has the latest information on when, where, and how to vote. Visit aarp.org/CTVotes.